Most of us know one of the most famous boxers in history, but did you know he has a nervous system disorder? According to an article by The Guardian, last updated March 19th, 2009, Muhammad Ali was diagnosed with Parkinson's disease in 1984 at the age of 42. Some experts believe that this was due to repeated trauma to the brain. He showed signs like slurred speech and slow body movements soon after he retired just 3 years prior. According to the article Statistics on Parkinson's by Parkinson's Disease Foundation, last updated in 2014, many as 1 million Americans live with Parkinson's disease, which is more than the combined number of people diagnosed with multiple sclerosis, muscular dystrophy, and Lou Gehrig's disease. Parkinson's disease is a very serious progressive nervous disorder that affects movement. Parkinson's disease is a very interesting disease because no one knows the cause of it, although we do know some of the signs and symptoms, and just a few treatments have been discovered. The causes of Parkinson's disease is unclear, but scientists have found a few factors that may lead to the cause of the disease. As stated in my PowerPoint handout that I have given you, the cause of Parkinson's is unknown, but scientists have figured out that genes and genetics could be the culprit. Scientists have discovered several genes. A small number of families are affected this way. Genetics is currently the subject of intense research studies. Parkinson's was Most of the gene mutation discoveries have been made in the past decade due to the human genome that was successfully sequenced. Research has shown that the disease has developed at an early age in individuals with mutations in genes for Parkin, PINK1, LRRK2. LRRK2 mutations developed during Parkinson's disease in people in age 30 to 40. Some people with this gene mutation are in their 80s and others never at all. The gene is called LRRK2 because of the protein DARDin. The protein is only associated with Parkinson's. Mutations in this gene that lead to the disease are most common in people of North Africa, Ask, Portuguese, Most people with LRRK2 develop dementia and others have amyotrophic lateral sclerosis, also known as ALS. The casual gene is another mutation that actually causes this disease. This alone guarantees that a person who inherits the gene will develop Parkinson's. Although this is very rare, only about 1 to 2% of people with Parkinson's has this mutation. The associated genes do not cause Parkinson's on their own, but it increases the risk of developing it. Some people have the gene but never develop it, while others without the gene can still be diagnosed. But others who have the gene are more likely to develop the disease than those without it. The gene combined with the gene identified to cause the disease was the gene alpha-synuclein, although also known as PARK1. After the discovery, scientists began looking for the alpha-synuclein protein in the brains of people who had died of Parkinson's disease. Lewy bodies, the protein clumps that accumulate in dying brain cells, are full of alpha-synuclein. These are microscopic markers of the disease. This has led to ideas for treatment, and it is one focus among researchers. Scientists are trying to lessen the amount of alpha-synuclein in the cells of people with the disease. They hope this method may show the progression or even reverse Parkinson's disease. By discovering genes linked to Parkinson's disease, scientists can figure out who is at risk for diagnosis purposes. Some suggest that Parkinson's disease may result from the exposure to environmental toxins or injury. Most people exposed to a toxin do not develop the disease. Some epidemiological research has identified several factors that may be linked to Parkinson's research, including water, manganese, and genetic factors, illness, environmental toxins, and other events may contribute to the disease, but no one really knows for sure. Although this cause is unknown, the signs and symptoms are very clear. The signs and symptoms are very invasive and can cause problems in everyday living. The chemical or genetic trigger that starts the brain death cell process in the brain of those with Parkinson's is the subject of intense scientific study. The nerve cells called neurons in the brain break down and die. The symptoms of the disease is due to the loss of neurons that produce the chemical called dopamine. When dopamine levels drop, it causes abnormal brain activity. According to an article by the Mayo Clinic Foundation, which was last updated in 2014, symptoms start in one side of the body. The first sign people usually notice is often tremors in the hand and fingers. This is when the hand and fingers shake and/or the pointer and the thumb rub back and forth in a pinrolling motion. it is often said to be mask-like. It also has an effect on speech, including slurred words and soft and monotone speech. The disease also causes thinking difficulties. Dementia often sets in during later stages. Emotions and change in patients experience fear, anxiety, and loss of motivation. About 50% of patients develop depression and 20% have memory loss. Some people even experience hallucinations. Other known symptoms include impaired posture, poor balance, loss of automatic movements like blinking and smiling. Although Parkinson's disease is not considered fatal, long-term patients decline in brain function, as it can allow other illnesses to take over and continues to the cause of death. The signs and symptoms cured, but merely treated. The treatments for Parkinson's disease range from medication to surgery. The medication treatments only subdue the symptoms. Medications can raise dopamine levels. Dopamine can't be given directly as it can't enter the brain, so medications are used. The benefits of drugs diminish over time. The first main medication is called carbidopa-levodopa. This is the most effective as it is a natural chemical that passes into the brain and converted to dopamine. Another main type of medication is called dopamine agonists. This does not change into dopamine, but they mimic dopamine and last longer. Surgery is another treatment option. This type of surgery was developed over 50 years ago, and it is called deep brain stimulation, also known as DBS. This is now a standard treatment for those suffering with Parkinson's disease where medications do not improve the symptoms. Over 300,000 people worldwide have DBS. According to the article, Deep Brain Stimulation by the National Parkinson's Foundation, last updated in 2014, during DBS, electrodes are inserted into the targeted brain region using MRI and neurophysiological mapping. An impulse generated under the collar impulses to the part of the brain involving motor function. This lasts for up to 3 to 5 years. DBS is not a cure for Parkinson's, and it does not slow the progression of the disease. For most people, it dramatically relieves symptoms and improves their quality of life. After DBS is performed, it can stabilize medication fluctuations, reduce or even stop involuntary movements, reduce tremors and rigidity, and improve slow movements. As you can see, Parkinson's is a terrible disease. It is a progressive nervous system disorder that affects many aspects of one's life. Although the cause is unknown, the signs and symptoms are very prominent, and a few treatments even have been developed to help cope with the symptoms. Hopefully, science to or even reverse the disease with extensive research.